Consent for total hip replacement surgery. What type of total hip replacement is done? Cement, cementless, implant, and bearing surfaces. Aim is to relieve discomfort and disability. Alternative options operating, including what if we do nothing. Break reaction time takes 6 weeks to return to normal. Risk. VTE is a risk. 3% with prophylaxis and 10% without prophylaxis. PE with prophylaxis, fatal in 0.1% and non-fatal 1%. Nice, good clinical practice, mechanical prophylaxis for 4 weeks. Foot and calf pumps in hospital and below knee TED stockings. Heart attack 1:300 patients. Death in 1:300 patients. 90 days mortality rate in NJR. Loosening NJR inverse relationship between the age and survivorship. Nerve injury 0.5%. Can happen due to hematoma, traction, direct surgical injury, or screws. Peroneal nerve component is mostly involved. Farrell et al. 2005. High risk of sciatic nerve injury happens with lengthening DDH stem. Post-traumatic total hip replacement, uncemented implants, and posterior approach. In case of neurological injury, depends on what I think it was damaged intraoperably or not. Early exploration, CT ultrasound for hematoma or rotating screw. Full recovery in 50% and can take 1.5 years. Sural nerve graft can be used. Damage to obturator artery for placement of retractor inferior to tall. Fracture 1 to 4% higher in uncemented. Iliopsoas tendinitis, impingement, trochanteric bursitis, limb length discrepancy, heterotropic ossification, and infection.